Hey everyone. Today we're going to talk about something that so many of us experience, but almost never talk about out loud, the pelvic floor. We're really going to dig in and challenge this whole idea of what's considered normal when it comes to our bodies, especially with pain and dysfunction. So let's just dive right in. I want you to think about this. What if that discomfort you've just learned to live with, all those issues you kind of brush off as just part of being a woman or just what happens when you get older? What if they're actually your body trying to send you a really important message? It's time we learned how to decode those signals. All right, first up, painful periods. This is probably one of the biggest ones that just gets completely dismissed. We're told from a young age that it's just something you have to put up with, right? A monthly burden you've just got to endure. But what if that's not true? Does this sound familiar? So many of us end up internalizing the pain. We blame ourselves. We say things just like this, thinking that we're the problem. But the reality is, there could be a very real, very treatable medical reason for that pain. It's not a personal failing, it's a physical issue that needs attention. And that leads us to this staggering number. A condition called endometriosis affects a whopping 1 in 10 women. Think about that. This isn't some super rare, obscure disease. It is an incredibly common cause of severe, life-disrupting pelvic pain. So no, you are definitely not alone.
So what exactly is endometriosis? Well, to put it simply, it's when tissue that's supposed to be inside the uterus starts growing where it shouldn't, and that causes a whole lot of inflammation and pain. The symptoms can be all over the place too, from killer periods to pain with sex, or even painful bowel movements and bladder issues. It really just depends on where that tissue decides to set up shop.
So here's the bottom line. How do you know if your pain has crossed that line from typical period cramps to something you need to get checked out? This right here is a massive clue. If your pain is so bad that you're canceling your life, missing work, skipping school, bailing on your friends, that is a huge red flag that something more is going on. And this is the part that is just so unbelievably frustrating, because this kind of pain is brushed off so often. It takes an average of 7 to 10 years, a decade, for many people to get an actual diagnosis. And in that time, the disease can get much worse, affecting everything from your fertility to your day-to-day quality of life. Okay, let's move on to our second red flag, which is another topic that's often surrounded by a whole lot of silence, and that's painful intercourse. Let me just say this loud and clear so everyone can hear it. Sex is not supposed to hurt, period. I absolutely love this quote because it completely reframes how we think about pain. It's not a weakness. It's not something you just have to grit your teeth and push through. It's data. It's your body literally talking to you, telling you, hey, something over here isn't working right. Can you please pay attention? Now, one really common reason for painful intercourse is a condition called vaginismus. And I need to be super clear about this. This is not in your head. It's a physical, totally involuntary spasm of your pelvic floor muscles. For many people, it literally feels like you're hitting a brick wall. It can make any kind of insertion, a tampon, speculum at the doctor's, or a partner, feel impossible. And this is just a perfect analogy to understand it. You know when you get a big, tight, painful knot in your neck or your shoulder and it gives you a headache? You wouldn't just ignore it, right? You try to stretch it out, maybe get a massage. Well, vaginismus is the exact same idea. It's a muscle knot that can be treated, often with things like physical therapy and targeted exercises. It is absolutely solvable. Okay, on to our third big red flag, leaking urine or incontinence. Now, this is incredibly common, especially after having kids, but I have to say it again. Common does not mean normal. If you ask a pelvic floor physical therapist how much leakage is normal, the answer is always 0. None. And what's really important to get is that not all leaking is the same. There's stress incontinence. That's the little bit that happens when you cough, sneeze, or jump on a trampoline. That's usually related to muscle weakness. But then there's urge incontinence, that frantic, I have to go right now feeling. And funnily enough, that's often linked to the exact opposite problem, muscles that are too tight. And this brings us to one of the biggest myths in pelvic health. We've all heard it, right? Oh, you're leaking. Just do more Kegels. But think about it. If your problem is a muscle that's already way too tense, like that knot in your neck we were talking about, trying to strengthen it is like trying to lift weights with a muscle that's already cramping. You can actually make things worse. Sometimes you have to learn how to relax the muscle first. All right, let's get into something we almost never connect with pelvic health, but is actually, well, everything. Poop.
Yep, we're going there. Because being chronically constipated can totally wreak havoc on your entire pelvic floor.
So, first off, what does a normal poop schedule even look like? Honestly, it's a huge range. Anywhere from 3 times a day to 3 times a week can be perfectly healthy. The really important parts aren't about the frequency, it's about the quality. You shouldn't have to strain, and when you're done, you should feel empty. That's the real goal.
And you can see how this creates a whole domino effect. If you're constantly straining on the toilet day after day, you're putting this immense, repetitive pressure on your pelvic floor. And over time, that pressure weakens and stretches out those crucial supportive muscles. And guess what that can lead to? Yep, things like urinary leakage or even pelvic organ prolapse. It's all connected. So let's start to pull all of these pieces together. We've talked about painful periods, pain with sex, leaking, constipation. It's time to stop seeing these as 4 separate problems and start seeing them for what they are, a chorus of signals from your body telling you something's up.
And just to round things out, here are a few more really specific signals to look for, especially when it comes to your bowel health. Things like always feeling like you didn't quite finish, or a weird sensation of a poop pocket, which can actually be a sign of prolapse, or staining, urgency. These are all important clues that your pelvic floor needs some support.
So here it is, the single most important takeaway from all of this. These things are not separate random issues. They are deeply, deeply interconnected. They are all different symptoms that very often point back to the same root cause, a dysfunction in that amazing, complex system of muscles and nerves we call the pelvic floor.
And let's end on this thought because it's so empowering. Seeing these red flags isn't a life sentence. It doesn't mean you're broken or you just have to deal with it forever. It's just information. It's your body giving you a roadmap, pointing you in the direction of getting a diagnosis, getting treatment, and starting to heal.
So, I'll just leave you with this one question to think about. After hearing all of this, what signals, what red flags might your body be showing you? Because just recognizing them, just naming them, is the very first and most powerful step you can take toward getting the help and the relief you absolutely deserve. Thanks for tuning in.